Welcome to the show, Cleveland's own Mayor Frank Jackson. Good afternoon, sir.
Hello.
How you doing today?
I'm doing good. What about you?
We doing all right, man. We doing all right, man. You know, we try to make sure we, stay safe and continue to update people on what is happening in our great city.
Well, the communication side is important on this because the more isolated people become, then they are trying to pick up information from whatever their favorite source is.
Yeah. Well, we got you on today, Brother Mayor, and we want you to give us an update on what is happening. Any changes? I know that we're under the civil emergency until April the 30th.
Right. We extended it from March 31st, which was, I think, Tuesday or Monday, and we extended it to April 30th. And we'll do that. We'll continue to extend or not extend depending on what the needs are.
Yeah. So the Department of Public Utilities, any changes there, any updates, any things we need to know?
Well, there are figures that we can give you, but we are not disconnecting, whether it's water or Cleveland Public Power customers.
Okay.
And that we are reconnecting based on request. So, and I believe in water, there's probably, in terms of reconnects, there's over 500. That's throughout our footprint. As you know, our water division covers not just Cleveland and Cuyahoga County, but is a much broader, is a regional kind of asset. And with Cleveland Public Power, I believe they're probably up to reconnects, probably in the area of 60 to 80 reconnects. Again, these are based on requests.
Now, how do you get the requests? How do I do that? I know it's kind of hard to get through.
Well, you call into utilities. We'll get you that number that they can call into. But it would be the customer service side.
Yeah, 216-664-4600. That's the number there?
I believe that's it, but again, we'll verify.
You know what? That's Cleveland Power. Water is 216-664-3130.
Okay.
That's what I have. Right
and then what they can do is help them process. Now, what we would like to know, if in fact people are having difficulty getting through. As you know, we're on essential and non-essential employees. So the call centers and the customer service would be essential because we're keeping that side of the operation open, as well as the operation around water main breaks and those things that we just have to do in order to keep the utility functioning. So if people are having problems getting through or not getting good information, we'd like to know it, because our assumption is that things are working unless we are told otherwise.
Yeah. And Mayor, what about I wanted to talk about the temporary hospital spaces. Any updates on that?
Well, as you know, that the virus is not waning; it is actually increasing, and the number of people who are infected has increased substantially from even March 1st to today.
Yeah.
So as a result of that, there's a projection that we will have a surge, and this surge will put a great demand on our hospital system in terms of those who not only are showing symptoms, but have been determined to be infected by the virus. And the question becomes, do we have the capacity, once this surge happens, to accommodate this? And that is the reason why the Cleveland Clinic, University Hospital, and Metro Health, and I believe the Sisters of Charity also, are working together to create additional bed capacity. With that, additional bed capacity, they would be able to look at people who may not be infected to the point of needing a respirator or things like that, or they may be showing symptoms and they're in some type of need to be in a hospital in terms of quarantine, and it would free up the intensive care unit for the most severe cases of the infection of the virus. And what is currently happening, the Cleveland Clinic announced today, along with University Hospitals, that they will be using their new medical school on Euclid as an overflow and for temporary hospital space, bed space, where they believe they can create 1,000 new beds there. Now, whether that will be sufficient, because right now they have enough capacity, but they're trying to build it out, anticipating this surge coming. Whether that will be sufficient when the surge hit becomes another question. One of the primary things that is keeping them from doing additional beds is two things. One, the staffing, because
that's what I was going to ask. Are we equipped here in Cleveland with enough staff?
We are equipped as of right now to handle what we currently have, and they're projecting the additional 1,000 beds. They're projecting that.
Okay.
Over that, then it becomes more problematic.
What about equipment, Mayor? What about the equipment?
That's the major thing, because even if they had the bed, they don't have the supplies they need and equipment that they need to be able to accommodate that. And that is more about the supply chain in terms of whether the mask, the gloves, the testing
ventilators,
devices, the ventilator, and all that. And that is still a huge problem nationally. Is a huge problem, and so that the federal government is woefully behind in terms of turning that great need for that supply, that demand for that supply, and fulfilling that demand. And now they're attempting now to build capacity by shifting manufacturing from one item to another to accommodate the supplies and the equipment that are needed, but it is not happening at the level it should happen to accommodate these surges that are expected to come. But right now, Cleveland is okay in terms of capacity. They're putting in 1,000 new beds. They believe that with that 1,000, they will have the staffing and the resources needed for that. Over that, it becomes more problematic for the hospital systems.
Yeah. All right, Mayor Frank Jackson, thank you for that update, and we'll look to talk to you hopefully next week.
Well, I would like to mention also that people have to take this serious, and that the more serious people take it, and the more they follow the basic rules that are in place around staying at home, except for essential and necessary travel kind of things, and wash their hands and keep social distance, the more they do that, then it does have a significant impact on suppressing the spread of the virus.
Yeah.
And that's the preventive measures. Once the virus has infected someone, then it goes into the treatment side. And if we don't practice the prevention side, then what we'll have is a much larger number of people who need the treatment, of which we will not have capacity to do that. So it's very important that people adhere to the basics here. Is not this is, as I tell people, this is not like watching TV or a movie. This is reality.
Right.
And reality says that if we're going to get through this and get through it in the best shape that we can and get through it in the shortest period of time, we need to create distance between people. People will have to wash their hands and practice that kind of hygiene to deal with the virus, and to stay at home so that there's very little contact with people other than having to do stuff. If you have to go to the grocery store, check on a loved one or something like that, those are different things. But that's the key. We have to follow those rules. If we do, what will happen, as I listen to the medical people, is that eventually it will plateau, meaning that all those who are infected will be known, and those who are new infections will be reduced because people are doing what they're supposed to, which means that we will get through it quicker and better in that situation. So I just say to people, take it serious and follow the 3 rules. Wash your hands, stay at home, and keep social distance.
All right, Mayor Frank Jackson, appreciate you. Thank you so much.
Okay, thank you.
All right.